save the National Health Service. And I'm glad to say he joins us now. Dr. Bob, thanks for coming on board the Sputnik.
Thank you.
Just paint briefly, if you will, the state of crisis that the NHS is now in.
Well, there's been several years of continuous relative underfunding. Since 2010, instead of getting the traditional 4% funding increase, the NHS has suffered a 0.8% increase per year. So over time, this has had a significant effect on the resources available to the NHS, to the staff, and ultimately impacts on patient care. So the NHS is being squeezed dry of resource.
And yet they said they had ring-fenced NHS funding. How does that work out?
Well, that's a complete deception. They also said no more top-down reorganisation in 2010, and in 2012 we had the Health and Social Care Act, the biggest privatisation act the NHS has seen. But it's part of a 20-year sequence of steady disorganisation, but this has all been deliberate because each new reform takes us further down the privatisation road.
I'm glad you mentioned that longer period, because it seems to me many of the NHS's problems now date back to the Blair-Brown era.
Or even further.
Or even further.
Thatcher era, no?
Even further, yeah. Kind of, with me, it goes without saying that most problems are located in the Thatcher era. But the difference is this. The Blair-Brown era said that they had solved the NHS's problems and that they had poured new money into it. But that was true only up to a point, wasn't it?
Well, a lot of the new money went into setting up the infrastructure for the whole-scale handover of our NHS to American corporations. But you're right, the problem started much earlier than that, in 1988, by Oliver Letwin. He wrote a document called Britain's biggest enterprise, where he set out the stages through which you could go through without the public noticing to get us to the US model. And unfortunately, Tony Blair, in his 13 years at the helm, followed the successive steps. But this was never told to the public because they can't get away with it. If the public knew what was afoot, they couldn't get away with it. So they had to disguise it in socialist jargon. He gave us the line, 7 days to save the NHS, before he got elected in 1997. In opposition, he talked about removing the market infrastructure, but actually when he got into power, he reinforced this. And he also took several steps which were major progressions in privatisation. For example, breaking up the hospital network into foundation trusts, which are like separate business entities. He saddled hospitals with PFI liability, private finance initiative liabilities. So the government borrowed 11 billion from private banks and financiers, and we have to pay back 80 billion. Now, this is a deliberate financial millstone to justify the sale and breakdown of the NHS further along the line. And to finish things off, in 2009, they brought in something called the unsustainable provider regime, which is a fake bankruptcy regime, framework to justify closing hospitals. And that was the regulation they used to try to go for Lewisham Hospital.
Yeah, I mean, the very idea of a hospital being bankrupt is so alien, it might as well have come from Mars. I drove past the Royal London Hospital just the other day. I used to say when I was the MP there, you would never find any member of the royal family in the Royal London Hospital. But it looks very nice now. The PFI-financed expansion and development has worked out at £1 million per bed. And I don't know what their finances are like, but I do know there are many other hospitals in England which are technically on the verge of, or over the verge of, bankruptcy. What does that actually mean in this context?
Well, in order to justify further closures and attacks on the health service, they had to restructure it from a care-delivering service to a business. And in order to say that, well, this business is failing, you saddle it with these deliberate debts, and then you use those debts to close down what we publicly own, to flog off the hospitals we own, flog off the land, shrink the NHS, bring it to the point of collapse, and then say, well, the only solution is yet more of the privatisation. So it's quite a clever financial scam that's been pulled off.
Well, clever if it works in the end. I just want to run that number past you again. Blair and Brown put 11 billion in, but the public must pay 80 billion back.
That's right.
To the private financiers of our national health service. That sounds to me like a crime, you know, a crime that you ought to actually be charged by the police.
Well, interestingly, the Labour Party still are very reluctant to talk about PFI. There is some concern that some of these were illegally financed. There's something called the Ryrie rules, which make clear that if you're going to go to the private sector, you need to make a cost-effectiveness, best value for money demonstration. But I don't think these loans, certainly they didn't meet those definitions, but the problem is you cannot look at these contracts because they hide behind commercial confidentiality. So we as campaigners want to open up these contracts and look at them and see whether there is criminality.
Even if there isn't criminality, it's a crime what's been done to what was Britain's crown jewels. We were the first in the world to develop this kind of framework for healthcare. And TTIP, if it comes about, that'll be the death knell, won't it? That'll be the lid on the coffin.
Well, it's a corporate power grab of all public services, and we have in charge of the NHS a gentleman called Simon Stevens. He needs to become a household name. He served the Blair governments. He then went on to work for United Health. While he was at United Health...
United Health's a private healthcare provider.
Yes, one of the biggest private insurers for healthcare in America. While he was there, he campaigned against Obamacare, Obama's reforms. He campaigned against those. Then he went on to campaign for TTIP to include healthcare. And now he's in charge of the NHS. So this is an extremely troubling development. But a lot of people who have been encouraged by the election of Jeremy Corbyn are still waiting to hear anything decent from the Shadow Health team. I went to a meeting with them a month ago and was looking forward to hearing something sensible from Heidi Alexander. But what we heard were narratives that fit into the ongoing privatisation. She expressed support for Simon Stevens despite his track record. And the next stages of the privatisation are to devolve the NHS budgets, to merge budgets with social care budgets, which have already been largely privatised, and then you will have contamination, and you'll also have the entry point for patient charges, and then co-payments. So the framework is all there. The narrative from the Labour Party still supports privatisation, and we are desperate to wake up the leadership to what is going on in the health team.
Well, of course, Labour's health spokesperson isn't on the same page as Jeremy Corbyn. She's one of the people who, well, let's put it kindly, is unpersuaded of Jeremy Corbyn's tenure. But you must get through to Jeremy himself. That what you're saying would be anathema to Jeremy Corbyn, I can tell you that, on 40 years' experience. You must somehow, let's hope this programme does it, wake up the Labour leadership to the extent to which we're sleepwalking into all of this. Let me confess something, some of which you've just said I have never heard before. And I'm a pretty switched on guy in terms of politics. I did not know that this man was running the National Health Service, having worked in America against Obamacare and for one of the world's biggest privatizers. So your campaign's a pretty urgently needed one. This is a 999 call.
It certainly is. Simon Stevens, in my view, is one of the most dangerous men in public office. He's taking us in completely the wrong direction. We know that the American model is responsible for 45,000 preventable deaths a year. That's not a system I want to be around to see in this country. Unfortunately, as I've said, the Shadow Health team are still supporting Simon Stevens. I think we need to highlight the problems that he is posing for the NHS. And this is where the junior doctors dispute comes in, actually.
Yes, she wanted to ask about that.
Well, the junior doctor situation is completely contrived. It was never a negotiation. There was always the threat of imposition. There was never any new money. The doctors were not arguing for a pay rise, and there are no new staff. But what he wants to achieve is to break the unsocial hours payment so that the assets can be sweated. So when the private companies take over, they can abuse their junior doctors. But as a helpful side product to what they're doing is to push out doctors, to save on redundancy and to replace them with a down-skilled workforce, a cheaper workforce, a more compliant workforce who will be more willing, perhaps, without the ethical binds that doctors have, to overlook what will be far less quality care. We were turning medicine into conveyor belt medicine. The focus of the private corporations will be for quick, easy, cheap, profitable activity. So they want to close down more A&Es, they want to close down more ITU units, and having a workforce crisis which they have created will also help their argument to shut down more.
And get your medicine from a vendor machine.
Get your medicine from wherever, but you won't necessarily need to be medically qualified to be issuing medical advice. And this is the toxic undercurrent to all these reforms.
And where do the consultants stand vis-à-vis the junior doctors? Because they're also very often accused of getting nicely paid behind the scenes.
Well, again, during the Labour years, it was important to keep the medical profession quiet. And as a GP, we had a very good outcome in 2004 with our new contract. But what we also gave away was our control of general practice. So they split away out-of-hours care. They also started to hive off and contract out for the first time in the NHS GP services. So you no longer had to be a GP or doctor to run a general practice surgery. Yeah. So anybody could do it. So you got Virgin. A bookie could do it. You've got Richard Branson, who's the biggest GP in the country. He's got 3 million patients on his books.
Dr. Richard Branson.
Dr. Richard Branson.
Yes, I'd forgotten about him.
So
this is a truly extraordinary story that you are telling, and if I may say so, extraordinarily well. We've run out of time for now, but I think you and I need to work together.
Certainly,
to
yes.
highlight this. Dr. Bob Gill, Save Our NHS campaign. Thanks for